I'm Lindsay Hall, and you're watching the Plastic Surgery Channel.
Welcome back to Plastic Surgery News. How would you like to have a facelift without facelift surgery? It's possible using stem cells, but is it right? To answer that question, you need to know what a stem cell is. In layman's terms, a stem cell is a cell from the human body that is pluripotent. That means that the cell has the potential to multiply and become any kind of tissue, lung tissue, skin tissue, anything. There are two kinds of stem cells: embryonic stem cells found in the umbilical cord blood and adult stem cells from sources such as fat and bone marrow. Both types are pluripotent, and both can potentially be used in medical therapy, including plastic and cosmetic surgery. Here's the theoretical application. When stem cells are injected into the patient's skin, they potentially can turn into fat, bone, muscle, skin, or other types of tissue, which can potentially regenerate older tissues into younger, healthier tissues, restoring the appearance of youth. Some scientists say that embryonic fetal tissue from elective abortions provides the best regenerative stem cells for anti-aging injections. However, pro-life organizations and others vehemently object to the use of embryonic stem cells since the human embryo is killed during the stem cell harvesting process. Fortunately, not all pluripotent stem cells come from unborn children. During liposuction, the unwanted fatty tissue that is sucked away contains a certain number of special cells called pre-fat cells. Researchers have recently discovered that these pre-fat cells are actually stem cells and can be tricked into becoming bone, connective tissue, nerve cells, and even muscle. But these potential applications are not current reality. Dr. Michael Shefflin, Senior Plastic Surgeon and Medical Director of Adadim Medical Center in Tel Aviv, is currently doing a study on the use of stem cells to enhance lipoinjection survival. We spoke with Dr. Shefflin to get his thoughts on the use of stem cells in new facelift procedures.
The fat has the highest concentration of stem cells in our body. In 100 cc's of fat, of normal fat, you have something in the vicinity of 25 million stem and regenerative cells. Basically, what we are doing is we are processing fat to get stem cells out of it, and then mix the adipose-derived stem cells with the fat to be injected. The idea behind it is to get 100% or near 100% graft retention in the face. So as we have been putting fake fat in the face in almost every facelift patient in the last 10 years or so, we're now enhancing that fat with stem cells to get a predictable, long-term, near 100% graft retention.
By using adult stem cells instead of stem cells taken from embryos, plastic surgeons could potentially replace lost tissue and build new tissue without presenting patients with a troubling ethical dilemma. Although stem cell facelift techniques and all stem cell applications in plastic surgery are completely experimental in nature, it's likely that the use of adult stem cells from liposuction in plastic and cosmetic surgery will become part of general practice in the future. The question is, will it be in our lifetime for us to benefit? As new developments arise, we'll bring you the news here first. Meanwhile, do patients who use Botox cosmetic and dermal fillers feel ashamed of their choice? Not according to a new survey. The Aesthetic Surgery Education and Research Foundation, the research arm of the American Society for Aesthetic Plastic Surgery, or ASAPS, says that some 87% of users of Botox and dermal fillers have no problem discussing their procedures in public. The survey, sponsored in part through a grant from Botox manufacturer Allergan, is aimed to dispel the myth that Botox and filler treatment are symbols of Hollywood vanity and the decadence of rich, aging layabouts. According to the survey, the typical injectables patient is a married, working mother between 41 and 55 years old with a household income in the 5 figures. 95% are actively involved in exercise, 78% eat right, and 32% volunteer in their communities. Survey subjects frequently cited the need to look more relaxed and less stressed as reasons behind choosing Botox, while many reported choosing dermal fillers in order to look more rejuvenated. Survey results also reveal that Botox injections are the most frequently performed cosmetic procedure among U.S. cosmetic surgeons, with hyaluronic acid dermal fillers such as Juvederm ranking third. The survey itself was commissioned by ASAPS and ASERF and conducted by Industry Insights, an independent research and consulting firm headquartered in Columbus, Ohio. It's time for a quick break, but we'll return with more plastic surgery news, including the story of a 17-year-old phenom who's taking pro tennis by storm, but thinks her game could improve with plastic surgery. We'll be right back.
Each year, more than 200,000 Americans undergo weight loss surgery. 200,000 people looking for a fresh start. The Weight Loss Surgery Channel is the world's first online television network devoted exclusively to the weight loss surgery community. Find the information, support, and guidance that can keep you on the road to success. You'll find it all online, 24 hours a day at the Weight Loss Surgery Channel.